My name is Kelly Grindrod. Welcome to the chapter Managing Relationships with Patients. On completion of this module, you'll be able to describe the differences between a patient and a customer, identify strategies for managing patient expectations related to pharmacy medication services, and identify opportunities to engage patients in conversations regarding the role of the pharmacist as healthcare provider. Let's start by talking about the difference between a patient and a customer. Around the world, pharmacist scope has been evolving to meet the healthcare demands of individuals. Examples of what pharmacists can do in some countries include providing immunizations and independent prescribing for a variety of conditions, which includes but is not limited to therapies for minor ailments. As we know in Ontario, pharmacist scope of practice has been keeping pace. In Ontario, pharmacists can adapt prescriptions, specifically the dose, dosage form, regimen, or route of administration. They can renew medications for continuity of care, administer influenza vaccines, perform point-of-care testing, offer hands-on training on how to use injectable medications, and prescribe medications for smoking cessation. Pharmacists are expected to use their knowledge and skills to best meet the needs of their patients. In addition to dispensing medications and providing education to patients, pharmacists have a broad array of tools that should be used to ensure each patient's healthcare needs and unique circumstances are being addressed. This applies to new prescriptions, refill prescriptions, over-the-counter consultations, and general drug, medical, or health information requests. Historically, changes in scope often mean changes in both our reputation and our relationships with others. Before Medicare, pharmacists were actually known as the poor man's doctor for the laborers who couldn't afford physician fees. We had strong relationships with patients who called us doc. Once pharmaceutical manufacturing was industrialized, we became the distributors of medications and the public became our customer. For a time, pharmacist scope was even limited to the sale of the products, and pharmacists were totally forbidden from offering any assessment or advice on a patient's care. As a result, pharmacists have spent much of the last century in the distributor role with little to offer beyond the product. However, current practice standards for pharmacists require pharmacists to assess patients to ensure all medications being used are appropriate. While some may believe a pharmacist's assessment is only limited to evaluating technical accuracy of a prescription, it's clear that in today's healthcare environment, this is not sufficient. Pharmacists and/or technicians definitely need to assess prescriptions for technical accuracy, but in addition to this, pharmacists need to assess each new and refill prescription for clinical appropriateness for the individual patient at hand. One way you may approach this clinical assessment is to review each medication to ensure that it's indicated, effective, safe, and that your patient is able to adhere to the regimens. Interestingly, healthcare payers in Ontario are following suit and are looking to pharmacists to provide consistent and comprehensive patient-centered medication services. The Ontario Ministry of Health and Long-Term Care, for example, is investing in patient care services as evidenced by the reduced spending on dispensing activities while supporting patient-centered care services through things like the Meds Check program, pharmaceutical opinion, and smoking cessation programs. Private insurance providers are also starting to offer support for smoking cessation and disease management. The shift in funding is meant to help pharmacists build on their professional services that value patient care over product distribution. In other words, when we talk about managing the relationship between pharmacists and the public, we are talking about the relationship each pharmacist has with their patients, not their customers, not somebody else's patient, our patient. Our patient, our responsibility. Let's take a look at one interaction.
Hi, can I help you with something?
Hi, I'd like to buy a bottle of Tylenol number 1, please.
Well, I hope I can help you with that, but first I need to ask you some questions.
What do you mean? I've taken Tylenol number 1 for years without any problems. They work great. I'm completely out of them and need a new bottle. Oh, and I don't have any allergies, don't worry.
Well, I'm happy to hear that you don't have any allergies and that this medication has worked well for you in the past. But in order for me to be able to sell it to you today, I actually need to conduct an assessment, and I'm looking to make sure that the medication is appropriate and safe for the reason that you're going to use it. That's actually the reason we keep Tylenol number 1 behind the counter, so that the pharmacist can be involved in this way.
Okay, I'll answer all your questions. I didn't really understand why the medication was behind the counter, and I wasn't aware of the risks to me or other people.
No problem. This will only take a few minutes. And my first question, can you tell me what it is you want to use the Tylenol number 1 for?
I have terrible headaches.
For headaches?
It's worth recognizing that the patient versus customer issue is not without controversy. In recent years, there has been some concern that the term patient is haunted by the healthcare industry's long history of putting the needs of care providers before the public. Some have suggested that terms such as client or consumer are good alternatives, as they remind us that we serve the public. However, the challenge is that in healthcare, we are not in the business of giving people what they want. Our job is to help people receive the care they need, which sometimes includes the hard stuff, such as refusing to fill a narcotic based on our assessment of the patient when we've decided it's inappropriate therapy. It may involve asking a patient to tolerate a difficult side effect in order to achieve the desired efficacy of a medication, or it could even involve delivering bad news. Being a healthcare provider involves working in partnership with patients to meet their medication-related needs, which may not match their medication-related wants. And research has shown that most people would rather be referred to as patient than consumer, client, purchaser, customer, or partner. In other words, the goal is not to change how we see the patient, but to align our services with the way patients see themselves. Now that we've established that we are talking about caring for your patients rather than customers or clients, let's talk about some strategies that you can use to manage patient expectations. There are 3 strategies that I'm going to review to help manage patient expectations. They include identifying the right patients, identifying the benefits you're trying to achieve, and getting the team on the same page. So, the first step is to identify the right patients to start with and then build from there. Essentially, this involves you using your professional judgment to determine which patients have the most need for a particular intervention or service. You spend all day with your patients, so you have the best insight into what they need and what you can offer to help them achieve their desired outcomes. For example, you may have a number of older patients who have multiple medications that are taken at different times throughout the day. If you do a lot of blister packing, then you are actually pretty good at simplifying regimens. In prioritizing your medication reviews, you may want to start by scheduling reviews with people who are likely to benefit from a simplified regimen, say someone who takes 7 or more medications a day. Once you're comfortable, you can then expand the reviews to people who are being discharged from hospital or who mention that they're going into hospital for an elective procedure. The purpose of starting with the right patients is to make sure that you know what you can deliver and to ensure that those with significant need are benefiting from your skill set. That brings us to the second strategy. You should have a clear objective every time you offer a service to a patient. Using the example of the older patients who take 7 or more medications, your main objective is to simplify the regimen by either stopping medications, combining multiple drugs into a single tablet, or minimizing the number of times a patient has to remember to take a pill each day. By having a purpose in mind, you are better prepared to tell the patient why you are offering the service and what they should expect from your time together, and also what they should not expect from that time. You are able to let patients know what you can and will do to contribute to their care. Now, let's take a look at another interaction with a patient.
Hi, can I help you?
Hi, I would like to refill my medications.
Okay, I can certainly help with that. Mrs. Jackson, I'm noticing here that you're taking 7 different medications, and many of these you're taking, it looks like, at least 3 times a day. Is that correct?
Yes, it's a full-time job keeping track of all of them. I just need you to refill the prescription so I can get going. I don't have time to discuss things. My doctor takes care of everything, so I just need you to refill all my pills as usual.
Okay, well, I can certainly refill them. That's not going to be a problem. But as part of my job as a pharmacist, I actually do assess each of the medications every time I refill them, just to make sure that they still make sense for you. And in doing that, I often look for opportunities to simplify things if that's something that you might find useful.
Oh, I see. I was not aware that you reviewed each of the medications. I really thought you just put the things the doctor ordered in the bottle for me. This is really interesting, and I feel safer knowing that you want to be sure the medications are right for me. Is there something you can do to make it easier for me to take all these medications? I didn't know this was possible.
This patient has an expectation of what should be done by the pharmacist. The pharmacist, however, really wants to do what is in the best interest of the patient and wants the patient to understand her role. Let's see how she communicates this to the patient.
Absolutely. There's a number of different options that I can suggest. Do you have about 15 minutes so that we could have a chat?
I was in a bit of a hurry, but I would like to make things easier. Why do you need so much time?
Well, it might not take the full 15 minutes, but what I'd like to do is get a sense for how you're currently taking all of the medications, what's working well, do you have any challenges, and by understanding your experience with the medications, I can then use that to come up with some suggestions that may actually be most useful for you, and then we can come up with a plan that I can communicate back to your physician. Does that sound okay?
Well, actually, that sounds great. I can stay for 15 minutes.
Perfect, let's get started.
The third strategy is about getting your team on the same page and builds on strategies 1 and 2. As you are identifying the right patients to start out with and the benefits you're trying to achieve, you should be getting input from the rest of the team to ensure that everyone can identify the right patients and clearly explain the targeted benefits. In most pharmacies, it's the pharmacy technician or pharmacy assistant who often is the one to flag a patient as eligible for a patient care service, to prepare the paperwork, and to schedule the appointment. Therefore, it's critical that they know who to look for and how to find the people who would benefit most. The pharmacy team may also want to talk about the following questions. Who is going to provide the service? What times of the day do you have pharmacist overlap? Will the service be delivered through a walk-in or a scheduled appointment? Will the pharmacy assistant or registered technician be identifying patients or booking appointments? Who will approach the patients to offer the service? For example, if you're going to start offering smoking cessation counseling during pharmacy hours, your plan should start by identifying who in the pharmacy needs to complete training. Next, plan for the type of patients you're going to target. For example, you may want to target older patients who are currently being treated for COPD, or patients who are employed by a local factory if that employer's insurance covers smoking cessation services. You may also choose to begin with any patient who you know has had a previous quit attempt or who has had a previous prescription for a smoking cessation drug. You should also identify a private and comfortable location in the pharmacy to provide the service, a time of day when you can regularly provide the service, and ensure any tools, forms, or resources you need are close at hand. You should agree on the main benefits you're focusing on, whether you're improving lung health, disease prevention, or the fact that it takes most people several attempts before they successfully quit. Finally, to manage patient expectations around availability, everyone in the store should agree on whether the service will be offered on a walk-in basis or by appointment, so patients know when they can expect to receive care. Most patients are willing to wait for services if they are told how long the expected wait will be. Informing our patients what to expect and when is key to successful engagement. Now that you know the patients you are targeting, the benefits you're aiming for, and the way you'll deliver the service, you have everything you need to approach a patient. I'd encourage you to start by having a goal to offer the service to at least one person each day. And finally, in closing, I often hear from recent pharmacy graduates and seasoned pharmacists that the hardest part about offering a new clinical service is rejection, especially if you work alone and don't have a good support network. So remember, change takes time, practice makes perfect. If your first patient says no, set a goal and ask another patient tomorrow. If you're struggling with anything, just reach out to a fellow pharmacist, either over the phone, by email, or through social media. Remember, we're all in this together.